Okay.
All right. So thanks again for the invitation. It's a great pleasure. As a psychiatrist, I actually have a lot of work these days because not only researchers are suffering, but a lot of other people as well. So, which again reminds us about the importance of social connection and mental health. And I'll say a little bit about this, but mainly try to give you a bit of a personal history, let's say, about developments in the past 20 years or so in social neuroscience, to describe what me and colleagues have called a second person neuroscience. And I'll also try to explain what the relationship of this may be with regard to psychiatry. So to start with, this is the year that I started to do research, 2002. I was a medical student at the time. And the guy the friendly person that you see on the top left is my academic mentor, Kai Vogelei, who's also a psychiatrist and a social neuroscientist, who at the time was very interested in learning about first person and third person perspective and their neurocorrelates. Yeah. So the typical task was a study where you would see an agent and then some layout on the wall, red balls, and you were asked, how many balls do you see as compared to how many balls does he see? And then you can sort of map that on to brain regions that show differential activations in this particular task. And I thought that this was very interesting, but at the same time, I also thought that this is really a non-interactive stimulus. Yeah. So I see something, I make up my mind, I try to understand it, I try to perform social cognitive tasks, and we look at what happens in the brain. And my interest was more in what I started calling a second person perspective, which relates to the direct social interaction. And this is something now, many years later, we can see we've learned quite a bit about in terms of the underlying neurocorrelates, brain connectivity, and their relation to these different kinds of tasks, yeah, more or less interactive tasks, and then of course situations that include hyperscanning and two brain investigations. And the very first study that I did, and unfortunately the videos are so old that I couldn't get them to play on my current computer, was a task that was still sort of non-interactive, but it's somewhat in the middle. So it's not a static stimulus. I don't just see a face depicted somehow, but those were actually dynamic videos of faces turning towards you, looking at you, and then generating a facial expression, as compared to a situation where you see the exact same facial expression, but it's directed towards someone else. And I was interested whether being addressed directly actually matters on the level of the brain. And this was sort of a task-based fMRI study where we were able to show that, for instance, amygdala responses and also ventromedial prefrontal cortex respond differentially when you are actually personally addressed. So this was sort of the first, my very first neuroimaging study that I conducted quite some time ago. But of course, it was clear to me that we needed to go on and look at more interactive situations. So basically close the loop between individuals to learn what happens in the brain. And this was closely related to an intuition that also grew at the time, which later on we described in the following way, namely that social cognition may actually be fundamentally different when we are emotionally engaged with others and when we are in a direct social interaction with them, as compared to a situation where you're merely observing other people. So something you could describe as social cognition from an interactor's as compared to from an observer's point of view. And this is something that we then went on to investigate by using a technique that we describe as interactive eye tracking or gaze-contingent stimuli. So we basically had a participant in the MRI scanner, and we used an eye tracking device to basically generate gaze data, feed the gaze data back to the stimulation computer, developed algorithms that help us to differentiate between situations of visual search and fixations, and then detect whether, for instance, fixations fall into predefined regions of interest on the screen. And we can use this information to then change what the person actually sees on the screen. And in the case of a face, this sort of virtual agent that you see here, you can basically use this information to make the face responsive to whether or not you look at it or whether you look away at different stimuli that you may also present on the screen. And in our first study, we basically used this to investigate the phenomenon of joint attention, which is often defined as a situation where you, together with another person, look at something, and both of you know that you are looking at this together. So it's sort of a mutual awareness. And what's interesting about joint attention is that it's an interactively constituted phenomenon. Yeah, so you need the behavioral alignment, the possibility to check back whether you are really looking at the same thing to make sure that you are sharing an experience. And in our task, it was a very simple task. We basically asked people to establish eye contact with a virtual character who we led people to believe was actually controlled by another person. So outside in the control room, we told them there's another person in front of an eye tracker, and he or she is really controlling the behavior of the virtual face that you see on the screen inside the scanner. While in fact, we were still using the computer algorithms that I just briefly introduced to control and systematically manipulate the behavior of the virtual agent. And in our study, we had a joint attention condition, which works the following way. And if the video works, yes. So you see a small black dot, which basically represents the gaze position of the person inside the scanner. And you can now see how, using this gaze position data, we can systematically manipulate the gaze behavior of the virtual agent in such a way that it always follows the gaze of the participant. And this is something that people actually quite enjoy and like. And those were the types of studies that we then went on to doing, sort of closing this interactive feedback loop. And those studies were helpful because they taught us quite a bit about the importance of reward-related neurocircuitry. So we did studies where we were able to show that you can differentially activate medial orbital frontal cortex, but also the ventral striatum, when people were able to actually direct the gaze of the agent. And we also were able to show that the extent to which we see this activation actually varies as a function of the social network. So how many people actually, how many persons a participant actually meets on a regular basis in their real life. We were able to also show that there's a correlation with pleasantness ratings, so how much you like being able to engage in this kind of interaction also scales with the activation size and things like this. And some preliminary data actually also show that in autistic individuals, you see an absence or a hypoactivation of the ventral striatum. Now, in the past years that I've been in Munich running the group, we've moved on because we wanted to further improve this eye tracking technology in such a way that we actually now can use real video sequences. So until then, we were always using these anthropomorphic virtual agents, which led to the criticism that while we were aiming for higher ecological validity in our tasks, we were not using real videos of persons. And this is something that we can now do. So this is a video from a study by Marie-Louise Brandi, where she was actually able to combine real videos of a person with this algorithmic approach to analyzing them based on gaze data. And in the study, we were able to convince 98% of our participants that they were actually interacting with Marie-Louise, even though they weren't, and we were just using little video snippets of her gaze behavior to generate this particular task. And here again, you can do a study of joint attention. So you ask people to look at objects, select an object, and observe whether or not Marie-Louise is following their gaze or not. And this is something that we then went on to use in a study where we wanted to explore the effects of interpersonal stress on the neural correlates of gaze-based interaction. So we had the following design where we invited people on different days into our lab, and we asked them to engage in the social interaction task. And they did so and were on these different days subjected also to hearing an auditory script, so a story that was either neutral or stressful, where before they had participated in our study, in this part of the study, we had interviewed individuals about stressful life events. So interpersonally stressful life events, such as breaking up with your boyfriend or maybe losing an important person in your life. And we used these auditory inhibitory scripts to see whether this would have an effect on people's, of course, subjective experience, but also on the neural basis of gaze-based social interactions. One thing that we found in the behavior is actually that we see a decrease of fixations on the face during an interaction after listening to a stressful imagery script. So when you're being stressed in this way, what happens is that you fixate less the eye region of another person, which is quite interesting, we found. And then, of course, we were interested to look at what happens in the brain. And one important first finding was that simply as a function of participation in gaze-based social interaction, you can recruit what is often described as the mentalizing network, which is quite interesting because, of course, this network was first described when you use tasks which actually require that people explicitly attribute the mental states to another person. Whereas now we can see that in the second person context, we can basically also ramp up activity in these particular brain regions, which raises all kinds of interesting developmental questions, I think, and we might get into this into the discussion. But of course, we were most interested to see whether interpersonal stress actually has an effect on the neurocorrelates of social interaction, which basically we looked at by investigating the interaction effect that you see here. And what we find there is that in addition to areas that were previously shown, so dorsal medial prefrontal cortex, we also see anterior cingulate cortex and also parts of the motor system and inferior frontal gyrus. So additional areas that we know are relevant for behavioral preparation, but also the conflict and error monitoring. So I just gave this sort of example and sort of little history to show you how basically I moved into using sort of fairly conventional tasks, non-interactive tasks, more towards these interactive studies. And this is something that, of course, we've also described in the BBS article in 2013, that we thought that there's actually this landscape of what you might, by way of metaphorically speaking, describe as a dark matter of social neuroscience. So social neuroscience being a field that really wants to investigate social interaction, but for different reasons, mostly methodological, finds this very hard to do. And fortunately, we've seen in the years since then really a very tremendous development in terms of people picking up on this notion and actually extending the methodologies and the experimental approaches to actually do this. So I won't say very much about the kinds of two-brain studies that are being conducted, because you'll hear about this from the experts later on, but I just wanted to sort of conceptually frame this in the following way. And then before leaving you to the rest of the conference, I wanted to maybe focus a little bit on another aspect that in recent years I found very important. So I think we also, apart from, of course, looking at the brain, we should also focus a lot on behavior when it comes to social interaction, because that's really, of course, the way in which people are bound together during social interactions. And our idea was that we wanted to develop more quantitative ways of measuring social interactions in real life contexts. And this is something that we've done, and this is work by Juha Lanakoski in my Munich group over the past years, where he has taken a situation where, for instance, you can ask people to play a game. So this is a game in German that we call Zitternix, keep it steady, where people have to manipulate little wooden sticks, and they do so either in a cooperative or competitive fashion. And Juha did this in a situation where he used infrared-based Kinect sensors to actually record the behavior of both peoples. And in this validation study, he also used inertial measurement units to basically validate his approach and to see whether the measurements that he can obtain from the Kinect sensors will be as reliable as the ones that you can get from these standard commercially available kinds of measuring units, which are often used to do motion tracking. So in this particular study, we wanted to establish measures of interpersonal coordination. And so one thing that, for instance, you can measure using this infrared-based approach is the distance between people, but also whether or not they look at each other. So you can infer gaze trajectories and see whether or not people are actually engaging in mutual gaze or whether they're looking at the table and the wooden sticks that you see on the table as well. You can also develop measures of interpersonal synchrony, so whether behavior of one person is affected by the behavior of the other and vice versa, and how this changes over time. And you can use these windowed cross correlations to actually also assess this in a more formal way. You can, like I said, also look at interpersonal distance, so whether people get close to one another during these sessions. And you can also look at joint orienting. So here we basically looked at the gaze angle of person A and B plotted across one another to basically have sort of a gaze orienting space in which you can then define areas where people based on the gaze angle are likely to have eye contact, or whether they engage in joint attention, or whether they just look away. This is something that we then investigated. So here in this video, this is a bit sped forward. So you can see how basically we are building up, for instance, this gaze-based plot, which tells you something about the relational format and how the gaze behavior of one person is affected by the gaze of the other. So we can basically have a quantitative fingerprint, let's say, of the reciprocity of the social interaction. Which is something that could be quite interesting, and I'll come back to that when, for instance, you think about patients with autism spectrum disorder. In our healthy controls that we investigated in the pilot study, we then also, of course, correlated these different measures with the subjective evaluations that we had acquired from the participants as well. And what you can see, for instance, is that there's a negative correlation between interpersonal distance and enjoyment. So the people who indicated that they really liked playing the game with the other person are actually the ones that had the smallest amount of interpersonal distance. Yeah, which is in line with other studies which have shown that in terms of rapport and sympathy for another person, this has an effect on how close you actually get to that person. And also we found that, interestingly, AQ, so the autistic traits that you can measure with the AQ self-report questionnaire, did not show any significant correlation for the different phases of the experiment, but only in between trials. So when people were getting ready to play the next round, when they did not have any explicit instructions, we actually see that there is a correlation. So people scoring higher on AQ in those situations tend to move away from the other person, which I think is quite interesting, that you only find this correlation in this particular phase of the task, because it reminds me as a psychiatrist that adults with autism are often very good at following rules, and in situations where there are no rules, this is when it will be difficult for them, and this is when the autism really shows up also in behavior. So I find this it reminds me of this kind of finding that I see here. And of course, from a clinical perspective, so over the past 5 years, I've been involved in heading what I call a clinic for disorders of social interaction. So from my perspective, it makes sense to actually construe psychiatric disorders as disorders of social interaction because they're ubiquitous social impairments. And many patients actually only come into psychiatry because they say that they have difficulty in social relations. Many of them are not at all convinced that they may have a psychiatric disorder, which of course is not always the case, but they sort of recognize this social these social aspects and these social impairments, which then are detrimental to them leading the kind of life that they would like to lead. We have a big focus and emphasis over the past years on autism, have developed different things also to help adults with high-functioning autism in terms of psychotherapy. And all of these clinical endeavors have now, in the last year, moved to Düsseldorf, where I'm now based in terms of the clinical department, and where we are basically continuing this clinical practice, but of course also together with the research. So if anyone of you wants to come in and check out the Clinic for Disorders of Social Interaction, you can find the email and also the phone number down there. in case there may be any need. And this is something that fortunately has also been recognized. So the work in terms of autism, also the psychotherapy that we've been developing, there's some recognition of this. So for instance, in this format, Unemployable Me, this was modeled after a BBC documentary where TV series were basically trying to help individuals with high functioning autism to find jobs. And this is something that we've been specializing in. So trying to find out what kind of profile a person has, what kind of job might be suitable for this person, and some of these patients that were in our clinic actually ended up also being followed by this documentary. And of course, the kind of interaction-based phenotyping that I've been talking about earlier is something that you can also use in the clinic. So as I've said before, autism is a case of course, which is characterized by qualitative impairments of social interaction and communication, and the reciprocity of the social interaction is not intact. But of course, until today, all of this is sort of observer-dependent clinical ratings. Yeah, so we have, for instance, the ADOS, which is a standardized tool where a trained person tries to observe certain social behavior or their absence, and based on this will then generate certain ratings. So it's an observer-dependent way of characterizing, of diagnosing, and also assessing the severity of autism. And our idea was, the driving force for this kind of research was to say, could we not find a quantitative, observer-independent way of measuring these kinds of social reciprocity deficits? And here we come back to the infrared-based sensors and motion tracking that I've briefly introduced earlier on. So now basically showing you a video of a person who came in for an assessment of autism, and at the end actually also received the diagnosis. And here again, we are using the motion tracking to basically capture the dynamics of the social interaction. And if you pay attention to the relational gaze plot on the top left, what you can see is that the gaze behavior of the patient is quite different from what you've seen before. So the gaze the pattern is basically shifted towards the right in terms of the gaze angle, which is due to the fact that this particular person is not making eye contact as often with the interviewer, who's the other person sitting in the background. Yeah, so this of course is sort of a rather extreme example, but of course I've chosen that to illustrate how the motion tracking can basically help us to quantitatively pick up on differences in the reciprocity, which otherwise you only assess from a clinical perspective. So when I'm in an interaction, I may have the sense that the person is not making eye contact in the same way as a non-autistic person. But this here sort of helps us to have a more, let's say, quantitative readout. And this, of course, is something that you can then also interrogate statistically, formally. So you can basically generate these kinds of gaze maps also for groups of individuals, neurotypicals, and persons with a diagnosis of autism spectrum disorders. And you can then, similar to how we do it in neuroimaging, you can basically compare these, if you like, activation maps or heat maps by performing a form of statistical parametric mapping to see whether there are areas or whether there are group-specific differences in these particular gaze patterns, which in fact is the case. You can also correct this, of course, statistically for multiple comparisons. And you can also relate this, as you can see on the right, to the ADOS ratings that we still obtain, of course, from these patients. So I find that these results really are quite promising and interesting, and may help us in the future to find more objective measures when we diagnose, but also when we try to make decisions about treatments. And another aspect that I find interesting is to think about ways in which we can use this kind of a behavioral assessment to then inform social neuroscience practices and also research into the neural mechanisms. So how can we relate these kinds of behavioral readouts and use them to interrogate, let's say, fMRI data? And this is something that Juha Lanakowski is also working on at the moment, and there's also some preliminary findings which are quite exciting. But to stay on time, I'll briefly sum up. So basically, what I think is very nice to see is that social neuroscience has really begun to take social interaction seriously, and that has helped to learn much more about the neurobasis of more ecologically valid social encounters. But I think it's also fair to say that we still need to do better, and focusing on real-world behavior, I think, is what might be one important next step, focusing on two brains, and you'll hear all about this during the conference today, I'm sure. And I also think that these new tools for interaction-based phenotyping may help us to learn more and have a more quantitative way to assess social impairments potentially in psychiatric disorders. And hopefully we can also use them to advance the study of the neuromechanisms of social interaction by guiding research towards those processes that are really clinically relevant. And with that, I'll show you all the friendly and brilliant people that I've had the privilege to hang out with over the past years in Munich, who've done all the hard work in terms of the research, but who've also been very helpful in the clinic. And with that, I'll end, hopefully on time. There are also a number of external collaborators that I should thank. Some of them are also part of this conference, I'm aware. So that's also very fitting and very nice. And of course, I would like to end by thanking you for your attention.
Okay, thank you. Thank you, Dr. Schibach. So we have 5 minutes for discussion, and those who have questions can cancel the mute and ask the speaker.
Hi, Leo. Can you hear me?
Yes, I can.
Hi. I'm a very big fan of a lot of work that you do, as you know, and I'm extremely excited about your interaction-based phenotyping that you showed at the end, based on video recordings of interviews, basically, right? Yeah. And you focused on the behavior and the data of the patients that you look at. Mm-hmm. Have you ever considered using the data of the clinician that you might want to match with a particular patient? Because this is interesting not only for autistic individuals but also for other social interaction disorders.
Yeah, I think that's exactly right. So maybe I didn't stress this enough. So it depends on the kind of measure, of course, that you're taking. But what I focused on were these relational gaze plots, right? And there we at least what we do is we focus on the behavior of both people, right? So we basically look at the gaze angle of person A and B. And how they're related to one another. But of course, what we haven't done so far is to only look at the clinician. But I think this is a very important idea. There's one study that Chris Frith always reminds me of. I think it's a study in schizophrenic patients, where you can see that clinicians, for instance, they compensate in terms of nonverbal behavior. So patients with schizophrenia, of course, often have reduced mimic behavior, reductions in nonverbal behavior. And what you can see, apparently, at least based on this one study that I'm aware of, is that clinicians will sort of compensate for this and will become more expressive in terms of their nonverbal behavior to sort of, if you like, by way of metaphorically speaking, repair, or equilibrate the social interaction. So I think this is quite important. It's also important from my perspective when you think about personality disorders or something that in psychology you would call complementary ways of managing a social interaction.
Exactly, yes.
Yeah. So for instance, if I'm talking to, let's say, a narcissistic person, I may have to do a lot to keep that person happy. Yeah. And interestingly, this is something that people automatically tend to do often until they get very angry and then don't want to have anything with the person anymore. Yeah. So I think you're completely right. It's very important to look at person A and B, see how this relates and how you may have these sort of, let's say, compensatory strategies which may help to ameliorate sort of interpersonal dissimilarities. So this is also a very important aspect in my work, also together with Dimitris Bolis, with whom I have this idea of what we call a social interaction mismatch hypothesis or misalignment hypothesis, where we say misalignment or interpersonal mismatch may be problematic for communication, but there may also be ways in which we can adapt and in which we can try to make sure that the kinds of differences that exist between people do not necessarily lead to a breakdown of the communication. And of course, human beings are very inventive and are very adaptive in that sense, but I think one exciting avenue for future research is to really look at this in a much more systematic way, related also to psychotherapy, to the kinds of treatment approaches, because often in psychiatry, what we do is we try to be nice to people, and this of course sounds very trivial, but psychiatry is sort of this little microcosm where we sort of accept people in the first instance for how they are. We try to find out whether that's related to an underlying psychiatric disorder, and then we try to work with the person, compensate for deficits so that this person will again have helpful and enjoyable social interaction, because we know that this is something that's important for all of us.
Great, thank you very much.
Okay.